Today, my name is Anna Talmadge. I am the Equity Coordinator on our COVID testing team at the Vermont Department of Health. And today's meeting is the second in a series of information sessions on our COVID-19 programs. We created this forum because we recognize that there are a lot of changes underway at both the national and state level in our COVID programs. And we also recognize that community partners are on the front lines of fielding a lot of these questions and disseminating key messages. So we really value that and want to equip you with the information on some of these programmatic updates. So before we get started, I'd like to remind everyone that this session is being recorded. I'd also like to recommend that during the meeting you keep yourself muted so we don't have background noise, and that you keep your camera off unless you're presenting or interpreting. This helped us last time with some bandwidth issues. So today's session is about COVID testing. Feel free to type your questions in the chat at any point or raise your hand if you'd like to come on your microphone. And feel free to reach out to me directly if you're experiencing any technical issues, and I can try and support you during the session. So with that, I'll hand it over to today's presenter, Alan Saltis, who is our testing coordinator.
Good morning, everyone. Thank you, Anna, for that introduction. Alan Saltis. I am the statewide COVID testing coordinator. I have been in the position since November of 2021. Prior to being onboarded in this capacity, I worked with our registration system for both vaccine and testing for the last 2 years. And I also participated early on in the pandemic as part of some of the testing clinics and following up on people's symptoms when we were first finding out about cases and documenting those for the CDC. So for today's presentation, if you were part of our technical session last week, Lucy did a fantastic job with a slide deck, gave a lot of scientific information. My presentation is going to be a little bit different. It's a little bit more relaxed. I'm going to be referring to our website a lot, but I know that there's interest in hearing some additional context to what's being provided as part of our communications plan. So that's going to be my goal for today, is to provide some additional context and some additional actions the Vermont Health Department and the state are taking with especially this big transition away from our public testing sites. And I'm hoping to be an active listener as well to gather any feedback, perceptions, perspectives, and hopefully move those forward so that we can make informed decisions moving forward around COVID testing. And so I'm going to attempt to share my screen and review a few things, and hopefully we can keep the bandwidth moving forward here. So I'm going to go ahead and share my screen. Make sure I have you guys in a place where I can see questions if they're coming in. So this is our healthvermont.gov main landing page for testing. If you haven't heard yet, our testing sites will be closing by June 25th, which will be this Saturday. Up until this Saturday, we will continue to provide PCR testing if that is what's needed. We're also distributing at-home tests. So I would, again, encourage, there's only a few days left, if you would like to pick up some at-home tests to have on hand when they may be needed. There's a few more days to do so. I wanted to give a little bit more background if you're new to COVID testing, or just additional context to kind of our public testing sites and how they've evolved and how we've gone to where we are today. Early on in the pandemic in 2020, the state recognized that there wasn't enough testing available throughout the state. It's one of the main tools that we had at the time without vaccinations to controlling spread of COVID in communities. And so early on, our offices of local health, Health Vermont Department staff stood up clinics in locations across the state. The National Guard was also activated, and they collaborated with the state to stand up additional sites. I participated in those sites early on, and so just thinking about all the resources that went into that, we were coordinating schedules, making sure that we were following best practices around sanitation, waivers. And so just going through that process of standing up the clinics was quite the experience. The state recognized that it wasn't sustainable to continue asking health department staff to continue these clinics. The National Guard was getting pulled into some other initiatives, like the Vermont food distributions throughout the state. And we were moving towards vaccinations in the spring. And so we asked for a request for proposal to contract for statewide testing. CIC Health was the winning bid for the statewide testing. And so in November of 2020, we worked with CIC Health and stood up additional testing sites all across the state of Vermont. And CIC Health, their strategy to make sure that there was testing available within 30 minutes driving of any Vermonter in the state, they subcontracted with some of our healthcare providers and emergency management services, EMS services. And so by the time we were rolling out vaccines in early 2021, we had testing sites throughout the state within about 30 minutes driving of anyone residing in the state. And that was our testing program. And testing was made broadly available to everyone. And at the time, we only had PCR testing. But the strategy was, if we can do testing of symptomatic, asymptomatic individuals, understand where COVID is in communities, that we could have some positive gains in just controlling how much spread there was of COVID, especially to our most vulnerable populations. So that evolved quickly. At the end of 2021, rapid tests, at-home tests were becoming more widely available. We ran a couple pilots at our public testing sites. We distributed LAMP tests, which is very similar to a PCR test. And I'm happy to go back into a little bit more information about the different types of tests and pros and cons, and I can add that into this general discussion. But we ran a couple pilots of distributing antigen and LAMP-based tests over the holidays when our lab was closed. That was pretty successful. We had to set up some additional systems for reporting and making sure that people could report their results back to the state. And then we moved quickly into March of 2022, after our initial Omicron surge, to doing rapid, widespread distributions of antigen and LAMP-based tests. And we've been doing that for the last couple of months. And we're at a place now where the health department is looking at our community testing sites as it's served a purpose, and it's been kind of a standing locations for the last 2.5 years. But at this time, with our healthcare partners and some pharmacies, I won't say all pharmacies, that testing is available for those that may have symptoms and may need to seek treatment if they test positive. There's other reasons such as travel or PCRs being required for under twos or access issues through those locations. And I'll talk about a couple of the different strategies that we're looking into to continue distributions of some COVID tests. But that's where we are kind of in our response right now, is that the state no longer needs to take a proactive approach with these testing sites. We've seen a decline in testing numbers We're going to make sure that we keep access high through a couple different strategies to make sure that people aren't having issues of accessing a test when they need one. So I'll pause there. There's a couple other things I want to review, and I definitely want to go into some of the other strategies, but I will just take a pause here. Anna, I don't know if there's any questions, or I'd welcome, I like answering questions kind of as a part of a discussion instead of hearing myself talk for 30 minutes. So I'd welcome some questions if there are any at this time before I go into some additional information.
Thanks, Alan. I can get us started with a few questions that were sent in advance through the form. We had a partner ask, will there be some publicly run walk-in clinics in communities with more at-risk people or with higher case counts?
Yeah, that's a great question. So right now, there have been a few discussions of continuing walk-in clinics to continue offering testing. We've looked at potentially utilizing EMS agencies and keeping a few sites online. We aren't moving in that direction right at this moment, but it could be a strategy that we could move towards if there was a need, if there was a lack of rapid tests on the open market or issues with insurance or need for PCR testing specifically. So it's something that we're holding on to as a strategy that could be implemented. What we're moving forward with right now is that we have our Aidc program. So Aidc is a local Vermont distribution company that the state has contracted with. In January, we set up direct shipment of COVID tests, both antigen and LAMP tests for congregate shelters. We've expanded that program to include some BIPOC community organizations to increase access and other high-risk community organizations serving, I guess, just higher risk populations. So that program is ongoing, and that's not going to be discontinued with this transition. That's going to continue to operate in the upcoming months. We have a process on our website that I can direct or navigate to if you're looking for more information about potentially enrolling. But in addition, we're looking at town offices, we're looking at municipalities, maybe libraries, food shelves, different points of contact specifically in communities that are local, that people are accessing other services, where we're looking into continuing to distribute rapid tests, potentially at these locations. Right now, we're in the early stages. And when I say early, we probably will get this off the ground in like a week, but we're having the initial conversations to gauge interest. And we're hoping that we can make tests available at these locations and then also just inform the general public of that these sites are offering these tests for free. So we're hoping that that will assist with some of the transition. We're hoping that will assist with if people are having issues going through a healthcare provider, maybe they don't have one, maybe there's issues with co-pays, issues going through insurance, having to pay an upfront cost and be reimbursed later, even if they have insurance. We know that there's some complications there. And so we want to make sure that tests are widely available. If you need a test, we want people to test immediately if they have any COVID-19 symptoms. And we want people to test if they're a close contact, especially if they're not up to date on vaccinations. So for those reasons, we want to make sure that access remains high. And so that's what we're looking at right now to increase access. So EMS, if we need to, we're ready to move in that direction. We've done a lot of meetings with healthcare providers and with pharmacies to address any concerns that they have. And at this time, we feel confident with our conversations with them that they'll be able to provide testing generally to the public, but I would say that we also understand that's not going to work for everyone. So we're looking at these other strategies as well.
Thanks, Alan. Really valuable information. I have a couple of questions in the chat. Someone was asking that they have several clients who don't have a computer or smartphone. Where should they be calling to find out where they can be tested? Would you direct them to the local health department or to 211? And a related question for folks who don't have easy access to transport. How could they get a medical ride, which would allow them to access testing?
So I can speak to the first question. If someone doesn't have a provider and they need testing and treatment potentially because of symptoms, they can call 211 to get information about obtaining a provider. I would encourage, if anyone's having issues accessing tests, they can reach out to their local Department of Health directly, and they have resources to assist with COVID testing if it's needed. And if it's more of a general inquiry or a question related to COVID testing, we still have a main call center, a main phone line that people can call, and they would direct them towards the appropriate resource, whether it's a question around travel or if they have symptoms or they just tested positive, what the next best steps would be for that individual based on their situation. So there's still some resources available for those that may not have access to internet or a smart device. And for the transportation question, that is something I can follow up on. I know that we've gotten this question a few times around a medical transport for testing. We still have homebound testing as well, which is, it comes with some restrictions on, having a provider that can prescribe a test and showing that you are homebound for a specific reason. We'll send an EMS agency out to conduct the testing, but I'm happy to follow up on what other transportation resources there may be for others.
Thanks, Alan. We have a couple questions about some of the proposals you spoke to about expanding access. So for municipal partners, this is a question from the city of Winooski specifically. If you are going to proceed with having municipal partners distribute test kits, will you be in touch with them directly? Is there venues that they should be expressing their interest directly?
Yeah, that's a great question. And that's where I'm saying we're in the early stages of figuring out how we should get this proposal out there to gather interest. Currently, our distribution chains that we've talked about are the Department of Libraries. There's about 180 libraries throughout the state of Vermont. We have the Vermont Everyone Eats program and the Vermont Food Bank, which serves over 300 locations and community initiatives for food shelves. So we're planning on reaching out there. For municipalities, I guess my question back to this group, if people are more familiar with this than I am, our plan was to reach out to the League of Town and Cities directly and see what distribution channels they have of getting this messaging out. If we could get 251 towns and regions onboarded, I think we would. We have capacity to do that. We probably won't hear from everyone, but if that was going to be our initial way to put the request out there and figure out what the appropriate distribution channels would look like.
Looks like that is receiving endorsement. And then
Great.
Laura had also asked similarly about whether town halls would be a distribution center. Yeah,
and it's certainly feasible. Right now, I think this is where information on our website doesn't really convey this. We do have antigen tests in inventory right now that we would like to get more broadly out there to the public so that they have them when needed for free without having any access issues. And so it would be feasible to onboard all towns with at least a one-time delivery. And based on the demand and where we are in the pandemic and what's needed, we can potentially resupply and offer additional opportunities. But we would love to get all town halls onboarded if they were interested. So we're going to gather the initial interests, figure out the systems to get test kits out to those partners and communicate that. And we're hoping to do that within the next week or two, understanding the transition for the public sites is happening this week. And I wish that we were another week ahead with this plan, but we're moving it forward as quickly but thoughtfully as possible.
Great, thank you. The next question is about the AIDC program. So confirming whether emergency shelters will still be able to order the test kits in the same manner that they have been. And I think for the group, I'm seeing a lot of the participants who are representing organizations who are already participating in AIDC. But for those not familiar, maybe just highlighting the criteria for eligibility and how organizations could enroll if they haven't yet.
Yeah, absolutely. So with the AIDC program, we're planning on continuing that for a period of 3 months. For the programs that are already onboarded, those programs can continue to access tests through that program. So that includes congregate shelters, emergency shelters with congregate living settings. It includes organizations that are serving BIPOC populations. We've also emphasized English language learners and migrant workers. We also have a couple of grants that will be continuing through this year, 2022. We have grants with Upper Valley Haven, Good Samaritan, Bridges to Health, Open Door Clinic. Just if people weren't aware of that, we have contracts in place throughout the end of the year. Designated agencies, we've been working with a few designated agencies providing mental health and substance use services. They also have a couple of congregate programs, domestic violence shelters, public housing sites. We worked with a couple SASH locations and just other congregate shelters. So all those types of programs, if they fall into one of those categories, if they're a nonprofit, we have an initial sign-up form, which we can share after this discussion. If you would like to inquire about signing up for the next 3 months and utilizing those resources, the AIDC program is primarily for the staff working in these settings, their residents, and it's just the primary reason is for safe opening and operations. So just ensuring that there's safety within the workplace when it comes to COVID and providing these critical services. And AIDC, let me get I've said it a few times and then sometimes I forget exactly what it stands for. But AIDC stands for the American International Distribution Corporation, which is the local company I referred to earlier. It's based out of Williston, Vermont. And so they provide they pick all the product, they put it in the box. They're like an Amazon distribution center, but local.
Great, thank you. We have a question about how long the AIDC program will continue. Will it be reassessed after that 3-month extension?
Yeah, so the 3-month extension was proposed and accepted as part of our transition period. So the simplest answer is it'll be assessed as we get closer to what things are looking like in 3 months. Right now, we're not seeing a lot of orders come through, and I think that's just representative of COVID community levels becoming lower in Vermont. We had our little uptick in cases, and now we're on the downward slope. So I think primarily for the next 3 months, we would encourage people who are enrolled or would be interested to order test kits now. All these test kits, it's always a moving target. One thing I wanted to talk about a little bit more was expiration dates. A lot of these times with what we have in the state that the state has purchased, they have expiration dates. Sometimes we're running up against a wall. Most of the time they get extended. And so it's hard to know in 3 months how much inventory we're going to have in the state of Vermont, what the funding sources are going to be. To continue this program for 3 months will come at a cost to the state of Vermont, but throughout this response, the state has set aside costs most of the time if we feel like this is the right thing to do, and it's supported by our EPI team. We move forward with it and we figure out the funding later. But we also have to be conscious of that when we're making these decisions. So in 3 months, we'll reevaluate what funding sources do we have, what are we seeing for orders, and have we heard other issues with accessing tests through normal channels? And so that's going to be the kind of the assessment process in 2 to 3 months to determine if we should extend it another few months.
Thanks, Alan. I think that's all the questions we've received in the chat. I'm not seeing anyone raising their hands, but do feel free if folks want to ask their questions verbally to come on the microphone. Otherwise, I know you had a few other things you wanted to highlight for today.
Yeah, so a couple other things I wanted to highlight. Just going to go back to sharing my screen here. On our Health Vermont website, we have been updating expiration dates and when to look out for those. So as I scroll down here, we put it closer to the top. Some of the test kits that the state of Vermont have been distributing have been iHealth in the past. So they've received a 3-month expiration date of the printed date on the box. Intrivo OnGo, if you go to a public testing site in the next couple of days and pick up some Intrivo antigen test kits, you'll most likely notice that the expiration dates are for March, April, May, or June. And I think it's just trying to get the general message out there that those test kits have also been extended for 6 months. So if it has a June expiration date, it's now good through November. And we're trying to do as much messaging as we can on site and through our offices of local health about these expiration extensions, but it's hard to, this is one step removed from being at the very top of the page, and sometimes people don't get down to this, or maybe they're not even looking at our website. So we've been trying to come up with multiple strategies, whether it's a sticker on the box with the new date, it's a handout that comes with the box that explains that there's been an expiration extension. We're doing our best to communicate that. Lucera is the brand that we've been distributing. That's a LAMP-based test, which is a nucleic acid amplification test, similar to a PCR. Those haven't received an extension, but we're expecting them to receive anywhere between a 3 and 6 month extension at some point, but they have a pretty good expiration date at this point, so I think there'll be less questions and concerns. Couple other things that I just wanted to highlight here. So when should I get tested? This has been updated recently in the last couple of months. So just highlighting this, the main 2 reasons why we're recommending testing is as soon as possible if you have symptoms of COVID-19, even if your symptoms are mild. We've done some work to include messaging on the test kits that we're distributing, ensuring if you're over the age of 65 or if you're at higher risk and you test positive after having symptoms, that you should immediately reach out to your healthcare provider if you have one about treatment options. And then 211, I think, would be the resource if you don't have a provider, if you wanted to look at treatment options. The second bullet point is if you're a close contact to someone who tested positive for COVID-19, and you're not up to date on your vaccinations. We've received a lot of questions around this because it can be confusing on when to test. The CDC has a 3rd bullet point right now around large gatherings, testing after going to a large gathering. Our state EPI team, it's not our recommendation that that's necessary, but of course we will always push the messaging on what feels right to you and what's the best choice for you in your situation. That's what you should be doing, and we're not going to tell you to do anything otherwise. But the close contacts, I'll just preview that might be changing in the next couple of months from the CDC, but that's the current recommendation right now. I think as a whole, thinking about COVID, and this is just general discussion. I'm not epi, I'm not a doctor, so just having an open discussion here. Most likely what we'll see with COVID-19 is that, at some point we'll get to a place where you're only testing, or the recommendation for the general public is that you test if you have symptoms, and that's the recommendation, like other viral respiratory diseases, but we're not quite there. We gotta be cautious with what's being recommended, moving too fast, and so that'll come from other places. Reporting your results, I wanted to just, we pushed messaging around reporting your results. I think we're moving away as a state. If you've tuned into some of the press conferences, we're not looking at case counts as heavily as we once did earlier in the pandemic, especially with a lot of the results being self-reported. But we do have an opportunity here to report your results. Especially, we would encourage people who test positive to report their results. If you come onto our website and you haven't seen this, this is what the reporting form looks like. I believe we received a few questions around this, and Anna, I don't know if this has come up with you as well, but we've asked for this page to be translated quite a few times. I don't know if that's available or not. So Anna, I don't know if you have any more information on that, but I remember that request from a month or two ago, and we looked into it.
I can. Yeah.
Okay. So I know that's one piece of feedback we had around the self-reporting form. Test types, again, I only want to go down roads that are useful for this group. There's a lot of talking points here with, what's the difference between PCR and LAMP? What's the difference between a nucleic acid amplification test and an antigen test? When should I use one over another? So there's a lot of different talking points here. So generally, if you had symptoms of COVID-19, the recommendation is to test right away. And the general consensus would be the best test is the test that's available to you. So if you have an antigen test on hand, or you have a LAMP test on hand, or you can access a PCR test, whatever test you can access would be the best test in that situation. There are pros and cons between using one over the other. I think one of the biggest things is that with any at-home test, there's always user error. So depending on if you were previously positive for COVID-19 or you're not testing within a certain window, there can be errors that might lead to a negative or positive. That might not be indicative of your current situation. And I'm happy to go more into this, but I don't know how much you want to go down this rabbit hole. But main point here is antigen tests. That test will show you if you have an active infection. A nucleic acid amplification test, which could be PCR or LAMP, will tell you if you have RNA virus fragments or active virus. So it's hard to tell sometimes whether or not you're actively symptomatic because it's such a sensitive test. And before I talk too much about it and confuse myself, I'm going to hold off there because it's not my area of expertise. But there's a couple other things around false positives if people wanted to talk about them. There's a little bit more information about these tests. If you do the drop down, we have translations for the tests that we have been distributing here on how to use each of the tests. So this will continue to be a resource moving forward. Some frequently asked questions about health department testing. This information will most likely be going away within the next week, so I wanted to preview that. But you will see our website receive updates. The same will be true for where to get tested. So currently you're able to see all of the different locations. We have a lot of messaging here at the top about the transition of our public sites. This is the one place where I did want to highlight for nonprofit community organizations. If you're interested in potentially seeing if you qualify for the Aidc program, please email us at the AHS COVID testing at vermont.gov. And maybe Anna, you can just drop that in the chat real quick. But if you reach out, we'll see if you're eligible and we'll get you onboarded for that AIDC program. But this is just previewing again. Currently, we have a map of our sites. This will be going away as well once we transition away from our testing sites. For a pharmacy, if you are looking for testing at-home tests through a pharmacy, it's probably more effective to go on the Walgreens website or the Kenny's website to see what locations are nearest you, or a lot of people use Google Maps. I think we determined that it would be more harmful to have outdated information that we're not always looking at if we continue to provide a map. The same is going to be true of some of the locations down here. I'm hoping that we can replace this with the town offices and the libraries and anyone that decides to sign up for at least the one-time distribution of tests and are going to be a community resource if we're coming up with maybe a communications plan so that people know that tests have been distributed there so that they can reach out without having to do an extra phone call. So that'll be a work in progress, but you'll see that this page will look very different next week, more limited information. So I just wanted to preview that. And outside of that, there's a couple other pages. And again, I think my intention without doing slides is to offer kind of a resource page after this discussion so that people are aware of where to find these different links. But a couple other pages that we have currently is protecting yourself and others, where we also have some translated material and messaging on this page. This is really just getting tested when you're needed, staying home if you're sick, some other precautions that you may or may not choose to participate in, like masking, and then what to do if you're a close contact. We'll continue to update this information as it is updated by the CDC, but as I previewed, the close contact information might be changing soon. Huge impact on childcare centers right now that they're having. We know that there's, with the public testing sites being pulled back and that transitioning, we're continuing to support childcare centers with direct access to rapid tests. Only serves the ages 2 and up currently. But if that close contact information change, we might go back to a time where we're going back to pre-pandemic symptomatic protocols set up for childcare centers. So now I feel like I'm just rambling a little bit, but there's a couple websites here, or a couple links. Our website's not the easiest to navigate, so we'll provide a page with the links to this information and where to look for updated information as in the upcoming weeks and months. And I think those were the main points I wanted to touch base on. And the last thing, and again, sorry, I'm a rambler here, but there's been some concerns with schools and what we're doing in the fall. So I did just want to preview that the state has taken a proactive approach to what we may see in the fall. And so we've done some pre-positioning of tests at school districts if testing should be needed. It's going to be very dependent on current state of the pandemic and current recommendations, but just to let people know that, you know, even if not everything is stated on our website, we have done some planning for the summer and the fall with our current inventory in case the state needs to have a proactive, be a proactive partner in the response. So I know that we've had a lot of changes and we've transitioned a lot of things, but I guess I wanted to say that we're also looking at if we need to come back in and stand things back up, that we're ready to do so.
Thanks, Alan. A couple additional questions in the chat. One about how a municipality would do proactive surveillance for the purpose of policy now that we don't have the case counts to rely on. And I think a related question is about the wastewater data, where we access that data and how folks could incorporate that into their surveillance.
So for surveillance testing, and I'm not going to try to answer this without being informed here. I can circle back with you, Elaine, directly after this meeting. For general surveillance testing, we're not recommending right now surveillance testing for most programs, most organizations. That doesn't mean that they can't set something up on their own if they feel like that is the best option for them. Right now, the state has had state employee testing surveillance programs. We've had surveillance programming for Department of Corrections. We are still continuing to support long-term care facilities. They have some federal requirements for surveillance testing, and surveillance testing does work in those settings. So we will continue to support long-term care facilities with resources. But for general surveillance, setting it up, I would love to connect offline because it's a tough one. What would you recommend based on community levels, the purpose it serves, what you're trying to accomplish? So I'd love to talk more about that.
Thanks. And I think this relates to our new surveillance report, which has been previewed in some other meetings with community partners. So feel free to let us know if you'd like us to connect you with the data teams as well for all of these surveillance questions. Another question in the chat was about the current turnaround times for a PCR test.
Sure. So through our state program, we've utilized the Broad Institute, which is a lab, out-of-state lab in Cambridge, Massachusetts. Our turnaround times have been between 2 and 3 days. I believe our messaging says 3 business days. Just sometimes there are delays with couriers and with their volumes. For most other programs, the state has worked with hospitals and worked with them to get equipment, Cepheid machines, which can provide rapid turnaround times for PCR. So it really varies depending on the equipment, volumes. Some places might be able to turn around a PCR in 2 to 4 hours, and another location might not be able to turn around for 2 or 3 days because it's getting shipped out to an outside lab. So the simplest answer there is that it varies greatly depending on the technology and what's being used for a PCR test and the turnaround time.
Great, thank you. Another question about the appropriate manner to dispose of unused or expired COVID tests. This was specifically about the antigen cards, but I think generally any advice about disposing of test kits?
Yeah, so the general information provided with the at-home tests is that a used test, whether it's positive or negative, can be disposed of in regular trash management system, so just in your household trash. Same is true if test kits, if you're distributing test kits and something that expires, it can also be just handled as normal household trash. We've had a couple of conversations about anything that might be toxic or an active ingredient that would be harmful to the environment. And thus far, working with our state departments, the general recommendations that we've been given after many discussions is that these at-home tests can be discarded as normal trash. There's some additional precautions that are taken in school settings and long-term care facilities where it's treated as medical waste. And so there's some extra precautions there because of that setting. But for the general public, if you're doing the testing at home, these tests can be discarded in your household trash.
Thanks. A follow-up question on data. So why the health department isn't providing the case numbers anymore. A lot of clients are still relying on something like the case dashboard to determine whether they feel comfortable and safe enough to go into their communities. If this is a question for another meeting, we can refer it there, but I think it generally relates to how people should be assessing their own personal risk without looking at the case dashboard.
And I think we probably could get a follow-up, some more follow-up information on that.
yeah, we can definitely loop back with the data teams, and I know they're hosting a few sessions of their own on the dashboard and some of the advancements with the surveillance report. So I'll follow up on email. That's the end of our questions in the chat. If anyone had additional questions or wanted to come on the microphone to ask a question.
Yes, hi, can you hear me? This is Elena Winooski.
Yes, go ahead, Elaine.
I know vaccines are supposed to be next week, and I know I've been peppering you, Anna, with this, but given that they're supposed to be available this week, or at least according to the news, it would be helpful to have some information about that. I know back when we did the third round of boosters, there was a lot of people that there were people that I knew of that weren't able to get their foot in the door because they had registered as BIPOC originally. So I want to make sure that doesn't happen again this round.
Great
So from
feedback.
working with our registration system, I know that the opportunities for vaccine clinics through our offices of local health, there won't be that issue. There are ways to register for those clinics that are not part of that TVRS Vermont. I can't even remember the name of the website any longer, but it's going to be separate from that registration system. So there shouldn't be issues signing up. Hopefully, the vaccine team has done an excellent job of really engaging community partners and understanding what capacity is out there. And so hopefully next week, Monica will have some additional details for you. And I don't know if
when
she's on
will the vaccines be available? Because if it's next week, then they're already going to be behind. This was the problem that we had with the boosters.
So I know the offices of local health are ready to move forward this week as soon as they can.
And how will BIPOC people be registering that for their children?
We can follow up and get you more information about how to register for those clinics.
Yeah, sorry, Elaine. I know we had a representative from our vaccine team on the call earlier, but I think they've jumped to a different meeting. But I will be sure to follow up today because I know that these are pretty pressing questions.
Thank you.
I'll pause for another minute in case anyone had additional questions. Not seeing anyone. I know we're close to the end of time. If you had any final takeaway messages, and then we will also follow up with a link to this recording and with a resource list of all of the different links and resources we've mentioned during this call afterwards.
And I'm just going to drop my email in the chat. I welcome anyone if you have any additional questions or if you have feedback that you didn't want to share on the call, that you can send an email directly to me. And I'm happy to receive feedback, suggestions, things that we could be doing better. We're always trying to make the best informed decisions on limited timelines sometimes. So would welcome any additional follow-up or conversations that if anyone was interested.
Great. Well, sounds like that's all the questions for today. Yes, please follow up with us. I think as our public testing sites close, also with additional feedback as we experience that transition, we'll be happy to hear from you. Thanks so much for joining us this morning. Thanks, Alan, for facilitating, and thank you, Joan, for interpreting. It's been a really productive session, and we'll look forward to seeing you next Tuesday for a session specifically about vaccines. Thanks, everyone.
Thanks, everyone.